Nicola Hill joins us now from London, our health correspondent. Nicola, what's happening? Is there actually a shortage of the flu vaccine, and should we be concerned if we can't get hold of it?
Well, the manufacturers say that they provided the numbers of vaccines that were ordered earlier this year, and that there should be enough to go round. Governments are saying they've got enough. But certainly anecdotally, people are saying, well, that's not the case. In China, for example, where normally the take-up of the flu vaccine isn't very low, it's doubled this year. So there's queues outside with people saying they're desperate to get it. Here in the UK, there's been a lot of chatter on social media, particularly amongst primary care physicians, who say that they don't have enough of the vaccine for themselves. So they've had to go and pay privately for their own vaccine in order to make sure they've got enough supplies for their patients. Now, also here in the UK, they changed the eligibility of who should be vaccinated, and they lowered the minimum age from 65 to 50. So, of course, that has increased demand. So that's one of the issues why there is the case, and it's something that Dr. Anne Moen from the WHO has been aware of. She's said that she's heard of this increased demand, and that's why she's recommending, as you've just said there, that it should be prioritised for healthcare workers and for older people. So one of the issues, of course, with the flu vaccine, and this is something that Dr. Simon Clark, who's a microbiologist at Reading University, was chatting to me about this morning, is the fact that when they manufacture it, they have to calculate which vaccine to do. That's because there's 4 different strains of flu, and each year a different one starts to circulate. So they have to have a balancing game where they wait long enough to work out which is going to be the circulating strain, but ensure they've got enough time to manufacture it and so it can be given to everybody. And that's why sometimes the flu vaccine doesn't necessarily work because the wrong strain has been put inside it. There's been several times over the past decade where that's been the case. So with demand increasing, obviously that is something that people are worried about. They want to ensure that maybe if they've got protection against the flu, if they get various symptoms, they'll know whether it's COVID-19 or not. So Professor Paul Hunter, who's Professor of Medicine at University of East Anglia, was saying this is why we have this fear of the Twindemic, which is a phrase that's being bandied around at the moment. Now, he says the danger is particularly if people catch the two sequentially. If you get flu, particularly if you're the type of person who has a compromised lung system, we know flu does kill. But if you're recovering, if you've been fighting the flu, you're recovering from flu, and then you get COVID-19 when your immune system's already depleted, and we know they're both upper respiratory infections initially with COVID-19, then it can kill people. And that's why flu first, then COVID is dangerous, COVID first, then flu next is dangerous. He says there's a theory that apparently if you get them both at the same time, he says he's not aware of that many cases of that being reported across the science. The theory is if you get them both at the same time, if you get flu, then you get COVID, your body's own immune system will make interferon to help defend you against the flu, and it could also help defend you against COVID-19. But he says that's a theory and that's not been proven.
Nicola, we've got less than a minute to go, but I wonder, the precautions that we're taking right now, wearing our masks, social distancing, isn't that enough to protect us from the flu?
Certainly seems to help. In Australia, for example, last year there were 800 deaths from flu. This year, the Southern Hemisphere, just coming out of the winter season, only 36. So, yeah, Professor Hunter says the social distancing that we do to protect us against COVID-19 is going to be effective against the flu because we're keeping away from people, we're not inhaling their germs, and of course washing our hands, keeping hygiene and wearing our mask will help.
All right, Nicola Hill, thank you very much indeed.